Myths. Myths can have factual origins or be completely fictional. They are often symbolic narratives of unknown origin. Myths could be attached to man, material, food, or cultural practices. When myth attaches to some essential practices, it deprived community of its benefits. For example, breastfeeding.
Breastfeeding is easy.
You should wash your nipples before breastfeeding.
All the weight you have put on during all those 9 months will go quickly overnight.
Majority of mothers naturally generate appropriate amount of milk for their infants. Having your baby close to your skin and offering your breast regularly will help kickstart the breastfeeding process as early as possible.
Yeah, and this nipple produce a unique substance which is smelled by the baby, and baby will recognize that she is my mother. Hello everyone. In today's video we are going to talk about myths surrounding breastfeeding. So there are lots of myths which are related with the breastfeeding. So let's bust all the myths related with the breastfeeding. I am Dr. Naresh Chauhan, public health expert. With me today, my wife.
Hi, I'm Dr. Deepika Naresh Chauhan and I'm a practicing homeopath.
So let's get started. So we have first, breastfeeding is easy.
Oh, they say babies are born with a natural reflex to look for their mother's breast. However, lots of mothers require natural help to find out how to hold their baby and ensure that the babies are latched properly onto their breast. I remember my own frustration. I thought I have been practicing for 6 years. I've done all the education and I have educated other people and I got this baby. And the breastfeeding, it felt like a disaster. Breastfeeding is a process. You got to be patient with yourself. You got to be patient with your baby. And sometimes it's working. And you don't believe it.
Breastfeeding hurt. Sore nipples are inevitable. Remember this. If the mother gets help in holding their baby and if it is properly positioned and attached to the nipple, then there will be no sore nipple. Because when the baby is not attached properly, there will be a futile effort on the part of the baby and baby will try vigorous effort to suck on the nipple. And so that the negative pressure created will lead to cracks in the nipple and the sore nipple. And remember that the sore nipple is very painful condition. If it is there, then you always consult your doctor. So if it is not treated, then later on there may be a complication. So that should be taken care of.
You should wash your nipples before breastfeeding. No, you don't need to wash your nipples before breastfeeding. The babies are born with a unique ability to recognize their mother's particular smell and sound.
Yeah, and this nipple produce a unique substance which is smelled by the baby, and baby will recognize that she is my mother.
And it contains good bacteria that help in building the baby's own strong immune system for life.
Separate newborn and the mother to let the mother rest. Why would you need to separate baby from the mother? On the contrary, healthcare personnel, they recommend that baby should be put skin to skin contact, what is known as kangaroo mother care. right after the baby is born. Now it means that you should put baby into your bare skin. Now if it is done properly, then it will help baby to frequently come into contact with the breast and the frequent breastfeeding. So in the initial part of the breastfeeding, if it is done frequently, then it will help you to establish breastfeeding. So it is really very helpful. If you can do this within the first hour after the birth and regularly afterward, it greatly supports successful breastfeeding. If mother can't do it, then the partner or another family member can take over this important contact.
You should only eat plain food while breastfeeding. Breastfeeding mothers, just like anyone else, should aim for a balanced diet.
Yes.
Typically, there's no need to make any major changes because baby already get used to the mother's food while they are still in the womb.
Yeah, eat lots of vegetables, fruits, and take care of your extra calories that is required because you are breastfeeding. And it's done. Exercise will affect the taste of your milk. This is funny. Actually, exercise is helpful. How will it affect the taste of breast milk? There is no proof that it will affect the taste of your breast milk. Exercise, on the contrary, will help you to strengthen your pelvic muscle as well as your abdominal muscle. And at the same time, it will help you to reduce your weight that you have gained during your pregnancy. Isn't it?
You won't be able to breastfeed unless you do it straight away. Yeah, I mean, it is easy if it is done as soon as possible. But there is no issue if it is delayed for some or the other reason. But it has to be done as soon as possible.
Yeah, it has to be done as soon as possible. But if the mother might have gone through the LSCS, then it might not be possible. But whenever it is possible, it should be started.
If you need help with latching your baby onto the breast, don't hesitate to ask a qualified lactational consultant or any other expert. Having your baby close to your skin and offering your breast regularly will help kickstart the breastfeeding process as early as possible.
Yes. You can never use formula if you want to breastfeed. Mother might want to choose the formula feed sometimes, and it is very difficult to get the impartial information on the formula feed. But if the mother wants to do so, she can. But remember that if you don't want to interrupt your breast milk supply, then you should also continue to breastfeed your child whenever it is possible. So remember that. What is next?
Many mothers can't produce enough milk. Majority of mothers produce enough amount of or enough quantity of milk on their own.
Yes, and it also depends upon how effectively you are breastfeeding your baby, the frequency of breastfeeding, and how effectively baby is latching on your breast. So it also depends upon that. So more the frequency of breastfeeding, more will be the production of breast milk.
For breastfeeding, mothers require assistance. This assistance includes continuous guidance from healthcare professionals on breastfeeding, practical support at home, and maintaining their health through a balanced diet and proper hydration.
You shouldn't breastfeed if you are sick. No, not true. On the contrary, most of the cases, only there are few situations where it is advised against breastfeeding. And the positive side is that whenever the mother is unwell, the antibodies which are produced inside the mother's body are transferred through the breast milk inside the baby. And so it will help baby to fight against those infections. Yes, but it is recommended to maintain good hygiene practices, for example, hand washing, and continue breastfeeding your baby so that they can benefit from the antibodies your body is producing. Unless you receive specific advice to the contrary, we would generally recommend breastfeeding.
You can't take any medication if you are breastfeeding. No. It is important to inform your doctor that you are breastfeeding, and very important to read the instructions on the medications that you are using over the counter.
And you should also inform your baby's doctor also that this kind of medicine you are taking. Babies who have been breastfed are clingy. No, that's definitely not true. All the babies are different. Some are clingy, some are not. And no matter how you are feeding them, but they are depend on you because they are breastfeeding. So it might look like they are clingy, but it is not so. If you are exclusively breastfeeding for the first 8 or 12 weeks of newborn's life, they will be with you during those feeding sessions. They are very frequent when they are little. I don't think that necessarily means that the babies are needy or clingy. And if the mother is working and if the breastfeeding is well established, then definitely there is role to pump and have someone else feed the breast milk in bottle.
Breastfeeding will prevent pregnancy. No, this is another myth we have seen people getting in trouble with. This is not an ideal form of contraception, or it's not an ideal form of birth control.
Yes, definitely. Sometimes there is a irregularity of menstruation if you are breastfeeding. But breastfeeding is not an ideal contraception.
We have unfortunately seen people who have conceived and they didn't even realize it because they were under the impression that breastfeeding is a sort of contraception.
It's hard to wean a baby if you breastfeed for more than a year. On the contrary, there are substantial evidence which suggests that if you continue breastfeeding for 2 years or so, there are lots of benefits to both baby as well as the mother. So it is not like that if you continue breastfeeding for a year, then it would be difficult. On the contrary, it is useful. So you should continue at least for 2 years. It is recommended.
If you go back to work, you will have to wean your baby. No, this is again a myth. Many mothers choose to continue to breastfeed even after they return to work. It depends upon the work policy and the environment where you are working.
Yeah, if someone is supporting and if they are allowing, you can bring your baby to the workplace and you can just breastfeed as many times as possible. Or you can pump your breast milk and in the bottle you can hand over the bottle to someone, your relatives, and they can feed the baby. Breastfeeding will help you lose all the baby weight quickly. Yeah, breastfeeding literally helps you to lose your weight because most of the lactating mother, they will lose extra 800 calories when they are breastfeeding their child. But breastfeeding is good, but it's not kind of magic. All the weight you have put on during all those 9 months will go quickly overnight. But it will take some time. It will take some time. For some women, it may be 3 months, 4 months, or maximum it may take 6 months or so. But definitely you are able to lose all that weight that you have gained during your pregnancy. Maybe this one is the last one.
Your milk supply can't be improved. No, your milk supply can be improved. So the more you put the baby to the breast, more amount of milk will be secreted.
So you should continue frequently breastfeeding your baby. That's the point.
You just have to keep feeding, stimulating, telling your body that there's a baby here and who needs milk, and your body will make it. Your body learns that habit, which is just fascinating to see and to have experienced. It really is about breastfeeding regularly, pumping, and then paying attention to the fact that hopefully you're not dehydrated, you're not overly stressed, and you are not running around doing all these other things that can make it hard for your body to continue to keep up.
Okay, so all the mothers there is a lot of advantages of breastfeeding to the mother, to the baby. So continue breastfeeding as long as you can. If you want to learn which are the advantages of breastfeeding, how to attach, how to position baby properly, you can view some other videos of our channel, and thank you all.